From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Friday, May 15th, 2020. I'm Cliff Baumgartner. Here's the latest from WREL.com. Today, Durham Mayor Steve Schewel said a stay-at-home order that has been in place for Durham County since late March will remain in effect indefinitely. A revised order, which takes effect at 5 p.m. tonight, will largely conform to Governor Roy Cooper's latest statewide order, allowing most businesses to operate if they adhere to strict cleaning protocols and take steps to ensure social distancing for both customers and employees. Durham has also put its limit on gatherings at 10 people to align with the state order. Previously, the city and county capped gatherings at 5 people. But Schewel said the local order will continue to be stricter than the state's in several ways, including requiring people to cover their faces in public whenever social distancing isn't feasible. Schewel said a local advisory group of clergy is also developing a list of best practices for churches to adopt as they start offering more in-person services, noting that officials advise churches to continue providing services through streaming or outdoors where people can exercise social distancing. Today, President Donald Trump said his administration is dedicating $10 billion to the development of a coronavirus vaccine through Operation Warp Speed. He said he hopes to have a vaccine ready for distribution to the public by the end of this year. So far, 14 promising candidates for vaccines have been identified, and researchers are working quickly to narrow that list. North Carolina's government is offering widespread testing and protective equipment to workers in 2 of the more vulnerable living settings for COVID-19 outbreaks. Yesterday, the Department of Public Safety unveiled a plan to make free testing available starting next week to over 21,000 employees in state prisons or juvenile facilities, or those who supervise offenders in the community, such as probation officers. An earlier strategy from the State Employee Health Insurance Plan to offer free direct testing to prison workers didn't happen, apparently due to logistics problems. Under the new initiative, testing will occur at FastMed urgent care locations, with results provided through LabCorp. Governor Roy Cooper also said yesterday that packages of personal protective equipment are being sent to each of the state's 3,800 long-term care facilities, which include nursing homes, rehabilitation centers, adult care homes, and group homes. Packets for workers include a 10 to 14 day supply of procedure masks, face shields, gloves, and shoe covers. More than half of the 600-plus people in North Carolina whose deaths were related to COVID-19 were residents in nursing homes, according to state health data, and more than 600 state prisoner inmates have tested positive, 5 of whom have died as of the time of this recording. One of the lead University of Washington researchers, whose team is now predicting more than 4,400 deaths in North Carolina from COVID-19 through early August, says state leaders are moving too quickly to reopen. Revised modeling from UW's Institute for Health Metrics and Evaluation, published on Tuesday, sharply increased the statewide number of expected coronavirus deaths, a 4-fold rise over past projections. Just 2 days before, the model from the university-based Independent Research Center put the forecast number of cumulative deaths in North Carolina at about 1,200 through August 4th. The changes to North Carolina's death forecast were among the most significant of any state. In an interview with WREL News, Ali Mokdad, professor of health metrics sciences at IHME, said the increases were squarely the result of people traveling and interacting more as talking of easing restrictions began to build. And he was unequivocal that Democratic Governor Roy Cooper's decision to roll back parts of his stay-at-home order were premature. Mokdad's comments come on the heels of calls from protesters and some Republican lawmakers for Cooper to move faster to restart the state economy, and as unemployment claims in the state filed since the pandemic topped 1.1 million. State Senate Leader Phil Berger this week called on the governor to grant counties the discretion to open restaurants and hair salons, pointing to other states in the Southeast that have already made similar moves. A recent WREL News poll, however, found that a majority of North Carolinians would support reopening the state around June 1st or later. Yesterday, the North Carolina Department of Health and Human Services debuted a list of public sites for coronavirus testing. The availability of tests and the proportion of tests that come back positive are integral to Governor Roy Cooper's phased plan to reopen the state. Leaders are looking for a decline or flattening in the number of people who show symptoms of the coronavirus, the number of confirmed cases, the percentage of positive tests, and the number of hospitalizations. Anyone with symptoms of coronavirus, which could include high fever, dry cough, and sudden overall weakness, should first contact their primary care physicians. However, not all healthcare providers are providing testing on site. You can find a searchable list of testing locations near you on our website. This has been your Coronavirus North Carolina News Brief for Friday, May 15th, 2020. As always, if you like the information and resources you get from this show, let us know. Give us a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.